Hi, I'm Dr. Christopher Barker. I am a clinical psychologist from New Jersey, and welcome to Holding Space. Today, we are holding space with Amy Friesen. You want to tell us a little more about what you're doing, but on the forms that you filled out, basically 20 plus years working in eldercare, and you're interested in the intersection of caregiving, family dynamics, attachment patterns, unresolved trauma, a topic near and dear to my heart, and aging. So, what are you working on? What's going on?
Absolutely. Thanks for having me. So I have over 20 years experience with elder care as a profession. And what I started to see was that my personal experience and my professional experience started to merge a couple of years back. And really what that meant was as people are beginning to age, there's a lot of people that are considered the caregivers, the adult children, but they have different ways in which they relate to their aging parents. And so with family dynamics and different relationships, that really dictates how elder care is done in a family, whether it's, one person helping, whether it's no people helping. And really trying to align that for both the seniors that we work with that, in my, what I call my day job and with Tea and Toast, where we really help with navigating health systems and housing for seniors. We have a slew of people that we work with there that have communication. The family gets along relatively well enough to be able to move through the process, but then we also have the other side where there's communication breakdown, there's family dynamics. And so how do we help those families address that? And sometimes it's being able to help those families as a whole, as a professional, being able to be more of a mediator to get things through. But also sometimes it's just helping the adult child who is deciding whether or not to step back into a family dynamic that they may have left. Could have been years ago, could have been recent, and what that looks like for that person, because society as a whole kind of says if you're an adult child you will be a caregiver, right? And so that's not really taking into account people's backgrounds, their child history, trauma, things like that. And so I shed light on that area as well.
Hmm, that's fascinating. I can imagine that that would be difficult. Speaking as someone who had an elderly mother, and she passed away about 13 years ago. It can be a real strain on a family to have to make that kind of change, to suddenly be thrust into a different role that you felt like you had left. What
hmm
what kinds of effects do you see?
Well, I think that elder care and planning as a whole, as an industry, is very difficult because a lot of people don't do the planning for ourselves aging, we don't do enough planning. And then when it comes to a point of us being the aged person, having our adult children maybe step in to help with that planning, there's not enough documentation, there's not enough direction to do it so that you really understand what your loved one wants. And so part of that reason is that we all don't really understand what the end point is, right? And so we all think we have more time, and so everybody kind of pushes those decisions off as far as they can until they're really staring them in their face. I would tell you I do have planners as well, but generally the trend is that. And so when you're talking to adult children that might be in estranged relationships or strained relationships and making a decision, do I become a caregiver? How much can I do? And that guilt that comes with it as well. And that pressure of like, society sort of saying I kind of have to be there. And, around those people, other people are saying that too, right? It's like, oh, well, aren't you going to care for your mom and dad? Or they're not getting any older, or you'll feel bad someday when they're gone and all that stuff. And so there's a lot of intricacy when you start looking into the family dynamics domain and really flushing out what's happening. And it's not really about, I'm estranged, I don't want to care for my loved one. It's way more complicated than that. It's more, I'm estranged often because I had to be, and I would have been a caregiver, but I can't now, or it's not safe or whatever. And so you're dealing with all of that as an adult child often. And then you have the adult in the family dynamics that are extreme, or even a little bit of family dynamics. You have the aging adults then saying, aren't you going to care for me? Aren't you going to help me? And then their friends and doctors and systems saying, aren't you going to help them? And so I've always found it really interesting, especially of late, that we don't take into account history. We just look at what's in front of us as a society to say, okay, well, this person's aging, they have 2 children, therefore there's 2 built-in caregivers, which is not super accurate for our people.
That's true. And you're right. I mean, the expectations of society are not often congruent with what a person's lived experience is. And not to mention, I mean, if you're an adult who is going to be caring for someone else, you get the rest of your family too. And, they're also brought into it.
Yeah, absolutely. You're balancing all of it, and oftentimes that's where you see a lot of caregiver burnout because you're literally balancing your origin family and any offshoots of that happening, plus your own family. And then, you're burning out because you're not taking the time to even just manage yourself, usually is what I see. And so there's sort of 3 buckets of, care management and us as adult children, as women often as well, men as well. But as the children age with the aging parents in the family, we're the ones that we usually put last. And that actually creates a domino effect across the board because once you go down and your health goes down, all the other dominoes go down too, especially if you're supporting all of those, right?
That's right. Yeah, you're absolutely correct. The person who's doing the caring is often the bottom of the barrel. They have to not only balance the caregiving of their own families they get exposed to. So what effect does that have on their ability to function?
I've talked to a lot of caregivers at various stages. I had one caregiver say, I cared for my mom for a number of years and then she passed away and I laid on a couch for a year because I could not function because sometimes people let it go way too far and then her spouse needed care and so she's trying to get back up to do that. And so as I'm working with her for her spouse, both seniors at this point, there's no capacity. The capacity's gone that, their window of tolerance is so small that they can't add on anything else. And so as a professional, we can take a lot of that on. We can take a lot of those logistics on that really overwhelm people. But often what I see is when people just push it way too far, it's avoidance, it's overwhelmed with like just basic logistics of, if they're looking for a residence for for this example, just the logistics of let's do a tour at this time, that date. It's a reminder from us and it's, making sure they're on, on point to show up. And so it's like just general logistics that go away. And then when you add their personal life of like appointments for the spouse in this case, their stuff, their appointments and things like that, every extra piece is really making things worse for them. And so then the avoidance is when it starts, they just stop doing anything and they kind of just like concave onto themselves.
Mm. I've noticed that there's a lack of here in the United States of places, people, agencies that provide that sort of intermediate step. Whether that's discharged from a psychiatric hospital or whether that's aging or whatever, we don't have a lot of people who sort of are there to address those needs and to meet those needs. I know I used to work for a program that would take people who had been chronically hospitalized. And this is back in the days before deinstitutionalization. Yes, I'm that old. And we had, I have to laugh. So would have nobody after that last step of taking them from a group home to a semi-supervised apartment back to the community. Then who picks up the pieces? And so, like when a parent is aging, or when there's somebody who needs extra care, who do we go to? That's a big problem.
We have and it's the same problem in Canada, right? And we have the public versus the private system of care, home care, retirement, long-term care, all of it, right? So we've got the 2 sort of silos. I find not only is there not enough care that's accessible because that's also financially accessible, but the 2 sectors, the 2 silos don't speak to each other very well. And so me being in the private sector, we try to communicate with public sector, but it doesn't go very well. And the public sector really doesn't communicate very well with the private sector. We should all be coordinating and collaborating to help the person we're helping. And even as of recently, the hospital system released a program that did rely on people going to facilities to retirement homes, which is private. until they could get into the public long-term care system, but didn't coordinate with retirement homes. So it's like all this guesswork. And so a lot of people are of the mind, they go and go to hospital and they stay in hospital until they can't stay in hospital anymore. And then locally here, we have a lot of transitional units, which are essentially full buildings of people in makeshift long-term care, just waiting it out until they can get there. The system is complicated and it's not getting much better, and it's really just getting overloaded. But I've been in this industry, like I said, over 20 years, and it's been getting overloaded the whole time. Now we just have this huge amount of extra people coming into the system right on the heels of COVID and all the people that just kind of pulled back a little bit. And now they're also going forward. And then when you add on family dynamics and you add the amount of people becoming estranged from their family, there goes the rest of the familiar support, right? So it's just kind of a cyclone in the mix here.
Yeah, it really is. And then that's a really good point too. I mean, is we get, I mean, you mentioned hospitals. I know that when I worked in a hospital, we would be frequently hard pressed to try to find some place for someone afterwards.
Hmm.
And between not being able to have a steady place and trying to find a placement, but just having to get people out, where do you put them? Is there somebody to care for them? If not, it makes the hospital social worker's job so much harder. And they frequently there's just kind of like, well, we just have to send them back home. But there may not be anybody to care for them on a regular basis, or even tentative plans don't always hold up.
Well, you just have
So,
that mittens process, right? Like even that new program I was speaking about, they go home with a certain amount of care. There's a couple of programs. They go home with a certain amount of care, and then this one program just stops. There's no actual fade out. It just stops, and then the person goes back to hospital, and it's this wicked cycle of really not solving the actual problem. It's just that band-aid because hospitals in general are just way too full. There's too much. Even the transitional homes, there's a couple of retirement home facilities that the whole home, 200 beds are just taken up by transition. So they just like kind of gave it over to the hospitals as transition units. And so, that it's just a mess kind of everywhere because they just sit there until you can get into long-term care. But then long-term care is so booked and so full, you can't actually get into it the way that the system's supposed to work. Whereas like crisis, of course, is number one. And then there's a couple of different categories and you apply and you wait it out. And they say, okay, well, it might be 3 to 5 years wait for a long-term care home. And then you have to figure out what to do in the meantime. But the system is so overloaded that now crisis is just everybody's going crisis. So all those people waiting are just bottom of the list. And it's just creating this never ending cycle.
yeah, it's so hard because I mean, there's so many bad places for people to go that aren't well staffed, they aren't well maintained, they aren't overseen very well. And so, like, finding a good place and being able to find a placement that, like you said, find an empty bed. Sometimes that's really difficult to do. And as the population gets older, in general, modern medicine being what it is, people are living longer. Once upon a time, your parents would pass away when you were quite young, and then you go on with the rest of your life. But now you may find yourself at 40, 50, 60 years old, still caring for somebody who is a parent who really needs the care, and there's just not much available for them. What's the best answer? If you could rule the world, what would you do?
Well, I was going to say, I have clients that actually call themselves a club sandwich generation. It's not just the sandwich generation of kids and parents. They also have a spouse at that point then. So I think the easiest low hanging fruit is planning. It really is. It's make sure that you're planning for yourself and make sure it's communicated to those who need to be in the know, because more often than not, I see people say, "Oh, well, Amy, I'm just going to go feet first in a pine box." And I say, if that's your plan, okay, but you have to make a plan to do that. And those people still are saying, I don't have to make a plan. And so they fall or whatnot. And they still end up in hospital. They still end up without the actual choices. And so planning for any and all of it is really that low hanging fruit, because then somebody can do something with it. Not only do adult children and others know what the wishes of the person are, and they can feel better about having to make decisions as a power of attorney, for instance. But it's very direct. Someone's actually taken the thought process. They've gotten their wills in place. They've gotten their POAs in place. They've gotten all this stuff so that it's not so difficult on the adult child or the caregiver that has to just come in from an agency randomly to help. I think that as this grouping of seniors are going through this process right now, that's who we're serving. We're also serving their adult children. And so what I see from that population are, 50-year-olds to 70-year-olds, call it, is that they're having exposure to what a retirement home is, what a long-term care home is, which is actually really, really good because it wasn't happening that much. A lot of the issues we have right now is that I don't want to move to a 1960s nursing home. And that's the vision they have from their grandma that was there. And so exposure is really good. So they have an idea for when they age or as they age. But then they also have gone through the fact of like, my mom and dad didn't have anything prepared. I like wills and POAs at last minute and all that stuff. And so my hope is that the adult children going through the cycle right now with their parents are seeing those holes and planning better for themselves and their children.
Mhm. Yes. I know, having done the will and all that stuff not so long ago, which probably I should have done sooner than I did. Again, planning. We have this tendency to believe that we're immortal, that we're just going to keep on going the way we are. And then one day we see Mick Jagger, and then we're like, damn, okay, this ends eventually. And we need to start making some plans. Sorry, Mick. I'm not vain enough to think that you're actually watching, but if you are, doing good, man. We have to sort of like get used to the idea that, there may be a need for services at some point, and we need to have plans to do that. Are there any particular easy routes to doing that? How would you go about the average person without hiring a high-priced lawyer?
Yeah, I think that, a lot of people, when I talk to them about this planning aspect, say, oh, I have my will, but I'm good. And I say, great that you have your will, but I need to know that you have a power of attorney because your will's for when you pass away. That doesn't tell anybody who's doing what when you're alive. So, really understanding the difference between documents, even advanced care documents of like, just written out your wishes. What do you want? I think that there's this false piece where as people age, they just assume that their adult children, for instance, will just pick up the slack and take care of things. And that's really visible in the family dynamics estrangement space because then you have people that maybe weren't great to you as a child all your life and then they're aging and they're saying, "Well, now you're going to take care of me," right? And things change. And those guilt trips and different things like that, they look different then, right? It's like, "Oh, well, you're gonna feel bad when I'm dead," and, like, all that stuff. And so I find it really interesting that, you know, people are coming into the space, it's interesting to me that the roles change as people age, and I think that a big piece of it in general would be, as mainstream society, if we would have more information on those types of backgrounds and information on aging and even education around, like, for us, we do education around what's retirement, what's long-term care, what's POAs, all of the stuff just for people to take the time to look at it. Like not even just from us, but just to be interested enough to educate themselves on their own aging and life journey. Because I think that's where really a lot of the problem is people don't want to look at it. And they just assume things will be picked up at the end of the day. Sometimes it works and sometimes it doesn't.
Yeah, I would think probably less often than not.
Yeah. And it's hard to make that assumption on people too, right? Because as you age, and if you are relying on your adult child, for instance, that they may do as much as they can, but then often they're balancing their family and all that stuff too. So it's like some of the stuff I talk about with my clients is that we all only really have one life to live. And I'm seeing people caregive for decades sometimes, depending on what it is. And so if there was communication and boundaries and all those things around it, structure, I think it would go a little bit smoother. But often what happens with caregiving is that one day mom and dad are fine, and the next day someone's in a hospital with a fall with a diagnosis of early dementia, and then it just keeps piling on and the caregiver can't catch up.
Mm. And that's a really good point.
And also, if I was gonna say, also, if people have dementia too, like, and the family's helping, the earlier planning, the better, because if you let it go too long, things get a lot stickier.
Also true. Yeah. Being able to be aware of your family history. What's likely to happen to me as a result of my genealogy, the history of my family. There are some things that need to be planned for. It's dark stuff sometimes to have to think on that, especially as we get. I mean, when you're 20, it's kind of like, oh yeah, I can think about this stuff tomorrow. But as you get to be 30, 40, or whatever I am, you start to look at it and say, yeah, I still don't want to think about it, but you really need to, and it's something that's really important.
It's interesting because a lot of people, when we talk about planning, there's kind of a lot of people that say, it's a gift for your children to plan. And it is, but the adult, like the senior in that case, doesn't really see it that way, right? It's like, it's time consuming. You're face on with, like, what is going to happen to you, and what if this happens, and do I want that, and all of these different care decisions that you're not 100% sure you're going to have to face, but you're sort of trying to plan for everything. And I think that, if we could just back it up, if we could plan a little earlier and back it up to say, right now, I'm gonna make sure I have a power of attorney, and then in a year or 6 months, I'm gonna do another piece, and then I'm gonna do another piece, instead of, like, getting to the end of life or in your 80s and saying, "Oh, I did nothing. I have no plans. I don't have anything." Because there's people arriving into their 80s and whatnot that still don't have powers of attorney, and so they have to do all of this extra work. There's caregivers taking off work on sick leave just to try to accommodate. So it just, again, it's that domino effect of everybody's in crisis when someone's in crisis.
That's a really good point. The system doesn't really support that, and again, a lot of people are working so that they can retire at 60, 65. And if you have your ducks in a row and if your financial system is good, then you can theoretically do that. But then you got to live another 30 years possibly. And who's going to be there if you really need somebody to be there? It's an important consideration. Not just what am I going to do? Oh, I'll go fishing a lot. It's more like what am I going to do if? So that if the time comes, there's not a scramble.
It's particularly important for the seniors in that aspect. It's particularly important if you're a solo senior, you have no kids and no family, or if you are the senior with an estranged family, to make sure that your ducks in a row too, because, one of the things, or sorry, and also low income, right? So there's, like, very specific things that, like, if you don't have any next of kin, you're it. So you really do need a plan, because somebody possibly in an ambulance is gonna pick you up. So, like, there's nobody else to call. And so that's, really important. And then if you're a low income senior, you might not have the availability of the facilities that are in the private sector, and the public sector has such a wait list that, safety at home is really important. Make sure that you're accounting for not falling and doing things to make sure that your home is safe. But unfortunately, I just see people kind of just overlook it and say, I'll deal with it tomorrow. And then tomorrow becomes like 4 years later. And they're just putting themselves at risk constantly with, like, this end goal of, I'm not sure. A lot of people feel like they're just going to pass away in their home, right? So it's, that's not often what I see. I see them in the hospital system trying to make a plan at the scrambling at the last minute.
Who other than you is there to tell people that they need to do this? Should we be advocating for more physicians to be talking to people about this as they go along, that sort of thing?
I think, as a whole, there's pockets of people, right? So one of the things from a physician point of view, from what I see, is that even just hospitals in general, social workers, the hospitals in general, don't have enough of an information piece on housing and home care, public and private. They have everything kind of public, but they have nothing on private. And so it, like, the collaboration is really where it's at. I see, there's, like, a lot of folks that come to us that have long-term doctors, which is coming few and far between at this point, right?
Mhm.
But the doctor doesn't know enough about housing, and so they say, you don't need to go to long-term care. And we're saying retirement might be a really nice option because you aren't eating well, you can't take care of your house, you're isolated, all this stuff. But the family doctor in those instances say, "You're great, don't move into one of those homes." And then the person literally does nothing because they trust the doctor, which is fair. But I think that education piece of saying, "Hey, there's more than one way to do this." And if anything, it's all ways. We need to look at all ways to support people. And so that education piece comes from the public sector that needs to have that link into the private sector so we can service better. We have home care companies trying to educate people. We have funeral homes trying to educate people, all sorts of things. People that are in the sector, in the private sector, we're all trying to educate, but it's not the same coming from the public sector. And I think that's where the disconnect is.
That's really important.
Mhm.
I hope everybody's listening to this.
E Even
Amy,
McGen
thank you for, especially Mick. Still doing good, man. I hope you stayed with us the whole time. Um, Thank you. I'm really glad you came in today. And, again, important messages that we really need to give some thought to.
Thanks so much for having
So,
me.
again, if you have any links or anything that you want us to put, at the bottom, please let us know so that we can stay in touch. And feel free to come back and, fill us in on how things are going. And thank you all, especially you, Mick, for tuning into Holding Space. And thanks for holding space for us. Leave comments, leave questions, like, subscribe, the usual things that they tell you. I will answer questions as quickly as I can. And Amy, if anybody has any questions for you, maybe they can address those also.
Yeah, you can reach me at amyfriesen.com.
All right.
Very easy.
Thank you.
Thanks for having me on. I appreciate it.
I appreciate you. Thanks.